back to Dr. Noah's YouTube update in terms of some really exciting type of natural nutraceuticals, natural medicines out there. And this is published in Journal of Alzheimer's Disease, July 2011, cutting edge. Alzheimer's explosion. We've talked about, in terms of the devastation both to the individuals and loved ones, but we've also talked about there's been scare in terms of the high cost of this devastating type of disease, and there's nothing out there in terms of medical procedures. There's lots of natural things. Go check out my YouTube, Dr. Noah Alzheimer. You see a patient who had Alzheimer's and now she's getting better. So there is hope out there. Well, in this article here, as we talked about in a peer review article, and this was from Cornell Medical School. Oh, that's right. That's another medical school. They state that CoQ10 shows potential in treatment of Alzheimer's disease. One of our favorites. I know Cindy had taken that for a while. Great antioxidants. It's part of the mitochondrial ATP production. Very, very beneficial. As they quote here is that compound CoQ10 is well tolerated. No side effects. Can't make a lot more money off of killing and hurting people. And is a promising therapeutic treatment in Alzheimer's disease. So once again, these are cutting edge type of scientists that know these natural products. You're not going to hear from it. One, because your drug doctor has no training in nutrition. Two is they're afraid to tell you because they might have to learn about nutrition. So yeah, so your drug doctor talks about CoQ10 and then you go in, and because I've talked about astaxanthin, and the guy looks at you like, what are you talking about? Yeah, because then he'll have to know about all these other cutting edge type of nutrients that are far superior than his drugs, and then he or she then once again won't get all the $19,000 that drug company spent. Omega-3 fatty acids reduce inflammation, anxiety, in medical students. So, talk about stress. Hey, being a doctor's tough, medical school is tough, chiropractic, naturopathic school, osteopathy school, all very stressful. Well, in this study here from Ohio State University, published in Brain Behavior Immunology, they had a randomized double-blind placebo-controlled study, which is the premier, giving one group of people 2.5 grams per day of good essential fatty acids, and they concluded that there was a reduction in anxiety symptoms among the omega-3 supplementation. Omega-3 fatty acid supplementation provides the first evidence that omega-3 have a potential anti-anxiety effect for individuals without any anxiety disorder diagnosis. So they don't even have to have the diagnosis, because anxiety is part of life. Being anxious about stress and strain, that's part of life. What the sad part is that it's overdiagnosed, and of course that gives drug doctors the privilege or the right to go ahead and give these people anti-anxiety drugs. They're very toxic, real questionable how beneficial. Here again, Cornell University Medical School, published in Brain Behavior Immunology, July 2011, that omega-3 fatty acid, that's the fish oils, are very, very important. And I usually recommend over fish oils, krill oil, which is even better. So that's very, very important. Talking a little bit about babies before and breast milk and formula. Cindy was talking about the push on that. Here is maternal supplementation with probiotics during pregnancy reduces the likelihood of atopic eczema. Common type of problem with little babies like that. Of course, they use steroids, very toxic. Definitely no science in terms of long-term harm to the baby or anybody else like this. Published in British Journal of Nutrition, July 2011, showing is that definitely looking at what's called meta-analysis, looking over 40 different studies, showing that found that probiotic supplementation during, this is their quote, during pregnancy found to prevent atopic eczema in offsprings 2 to 7 years. So even after the birthing process, up to 7 years later, by just having the mother do probiotics, which has wonderful benefits in preventing cancer, helping you to digest food, helping with different type of GI problems, very powerful. Now keep in mind that probiotics is like anything else. There's good quality and bad quality. You get what you pay for, and probiotics is probably a real big factor in terms of that. There's a lot of junk out there. There's lots in terms of what kind of strains, whether or not mutates, how long the life shelf is on that. Sure, it might be really good when they first create it. By the time you get it, it could be down to 0. So probiotics, a very, very powerful type of natural product for babies' eczema. Here's one, vitamin D status in breast cancer survival, published in Cancer Research, July 2011. And this comes from Germany. And so what they were able to look at in terms of looking at postmenopausal breast cancer patients, ages 50 to 74, and who were diagnosed between 2002 and 2005. And they were showing is that in conclusion, low vitamin D levels, and then low is below 50, some people say 75 of D3 or 2-hydroxy D3 blood tests like that is low, may be associated with poor overall survival and distant disease, which is metastasis survival in breast cancer patients. So here's some stuff we talked about: chemotherapy, radiation, very poor science, maybe extends life. Here's something that's very powerful, inexpensive, and safe that you can give to patients, especially with breast cancer survival. So that's what you're looking for. Not whether or not the tumor size decreases. You want to know how long you or your loved ones will live after the cancer diagnosis, and that's what this has been shown scientifically from Germany. Talk to you soon. Take care.